Hi, my name is Daniel DeLoma. I'm a hospice and palliative care chaplain and thanatologist. What I want to share with you today comes directly from the bedside. Moments when someone is no longer responding and the people around them are left wondering what to do. If you found this video, there's a good chance that you're in that moment or preparing for it. And what I want to do is to help you feel a little less uncertain in it. These are difficult moments. And if you're watching this, someone you love may no longer be responding. And that's one of the hardest moments people face in life. You're sitting here. You don't know if they can hear you. You don't know what to do with your hands. You don't know if you should talk or be quiet or just wait. And underneath all of that is the one question: am I doing this right? Well, I want to tell you something clearly. You are not going to harm them by being present. In fact, your presence may be one of the most important forms of care they receive. You'll notice I'm here with Mr. Fern. He's a mannequin, yes, but in these videos, he represents someone who is unresponsive and at the end of life. We use him so that we can learn this safely, without fear, before being with a real person. What I'm going to show you in these videos is something called meditative heartbeat therapy, or MHBT. It's a method that didn't come out of a lab. It came from sitting at bedsides. It's a way of being with someone when language is gone, cognition fades away, and all the usual ways that we relate are gone. But what remains is rhythm. The heartbeat is the first sound we hear, and very often it's the last thing still present at the end. MHBT uses that rhythm as a way to stay connected, not instead of medical care, but alongside it. You see, in hospice and palliative care settings where MHBT has been used alongside standard comfort care, we've seen some consistent things. Patients report relief and have evidence of relief from severe pain within about 4 to 6 minutes after morphine is administered, as opposed to the 15 to 20 minutes that it usually takes. Families reduce a dramatic reduction in anxiety, and clinicians often notice something important. Caregivers become more steady, more grounded, more able to stay present during these final hours. This is not about replacing medication, my friends. Morphine, oxygen, comfort meds, they're all important. They all matter. MHBT works with them. It helps the body and mind to settle into what's already being given. So, what can you actually do? Well, you don't need training or special equipment. There's no getting it right. Rather, you sit, you breathe, and you stay. You might feel like you're doing nothing, but my friend, you are not doing nothing. You are helping to create an environment where their body can rest, where their mind can settle, and where connection is still possible. Now, let's take a moment. If you want to try something right now with me, let's take a slow breath and listen for your heartbeat. It doesn't have to be perfect, just bring your attention to it. That's where this begins. Not with technique, but with attention. It's about being present. And so, friends, if this is where you are right now, sitting with someone who isn't responding, you're not alone in not knowing what to do. There is something you can do. You can stay, you can listen, you can be present. And that matters so much more than most people realize. If you would like to learn more, I encourage you to visit us at heartbeattherapy.com or explore our book, Meditative Heartbeat Therapy, where this is explained fully. But for now, just take a moment, take a breath, be with them, and stay.